Did you know that heart disease remains the #1 leading cause of death globally? It's a scary statistic, but here is the part that's even more concerning. Heart trouble doesn't always look like it does in the movies. We expect the dramatic chest clutching and the sudden fall, but in reality, heart disease is often a silent progressor. It whispers before it shouts. Many people ignore subtle changes in their body, thinking they are just tired, getting older, or dealing with a minor flu. But your body is an incredibly smart machine, and it often sends signals, sometimes in the weirdest places, like your feet or your jaw, to tell you that your heart is struggling. The good news? If you catch these signs early, you can often reverse the damage with lifestyle changes and medical help. Today, we are going to walk through 10 specific warning signs, some of which might completely surprise you. If you care about your health and the health of your loved ones, you need to watch this. Let's dive in.
We're going to start at the bottom, literally. Many heart problems first show up in your legs and feet because of circulation issues. Sign number 1, foot ulcers and open sores. You might think a sore on your foot is just from a bad pair of shoes, but if you have an open sore or ulcer that just won't heal, pay close attention. This can be a major red flag for a blockage in your aorta or other major arteries. When your heart can't pump blood effectively or your arteries are blocked, healing nutrients can't get to your extremities. If you see this, consult your doctor immediately. Sign number 2, leg cramps. We've all had a Charlie horse, but this is different. If you are frequently experiencing cramping in your buttocks, thighs, or calves, especially when you walk or move, it may indicate aortoiliac occlusive disease. This is a fancy way of saying your leg muscles aren't getting enough oxygenated blood. If the pain stops when you rest but comes back when you move, that's a classic warning sign. Sign number 3, unexplained toe pain. Following closely on that is sign number 3, toe pain. It sounds strange, right? But experiencing unexplained pain in your toes, specifically at rest, can also point to that same occlusive disease. Your toes are the furthest point from your heart. If the pump is failing or the pipes are clogged, your toes are the first to complain.
Moving up the body, let's talk about how your heart affects your lungs and fluid retention. Sign number 4, a productive cough. Now, everyone coughs during flu season, but a heart cough is different. If you have a persistent cough that produces white or pink-tinted mucus, do not ignore it. This pink tint can actually be traces of blood, and it often indicates fluid accumulation in the lungs, a condition called pulmonary edema. This happens when the heart isn't strong enough to pump blood forward, so fluid backs up into the lungs. Sign number 5, rapid weight gain. This is one of the most misunderstood symptoms. We aren't talking about gaining weight from eating too much over the holidays. We are talking about fluid weight. If your heart is failing, it triggers your kidneys to retain fluid. This results in scary fast weight gain. I'm talking about gaining 2 to 3 pounds in a single day or 5 pounds in a week. If you look in the mirror and look puffy or swollen and the scale is shooting up overnight, that is a fluid issue, and it's a major stressor on your heart.
Now let's talk about referred pain. This is when your brain gets confused about where pain is coming from because nerves cross paths. Sign number 6, jaw pain. This is a classic sign, especially in women, that is often missed. Experiencing atypical discomfort in your jaw, teeth, or even the side of your neck can be a subtle sign of a heart attack or angina. Because the nerves that supply the heart travel up the same pathway as the jaw, your brain might interpret heart distress as a toothache. If you have jaw pain with no dental issues, get it checked. Sign number 7, back pain. Specifically, pain that feels like it's originating from the chest and shooting through to the upper back. If you haven't lifted anything heavy recently, but you feel a deep, nagging ache between your shoulder blades, this could be your heart calling for help.
Finally, we have the signs that require immediate action. These are the ones where you shouldn't wait for an appointment. You need to seek help now. Sign number 8, throat tightness. Some people describe this as a choking sensation or a band tightening around the throat. If you experience ongoing and intense tightness in your throat, it could be a sign of a heart attack in progress. Try to stay calm, but contact emergency services immediately. Sign number 9, bad headaches. A headache can just be a headache, but a severe, sudden thunderclap headache can indicate a stroke or a blood clot traveling from the heart to the brain. If it's the worst headache of your life, treat it as an emergency. And number 10, arguably the most common pre-heart attack symptom, the cold sweat. If you suddenly break out in a clammy sweat without doing any exercise, maybe you're just sitting on the couch, this is your nervous system reacting to heart failure. If you feel cold, clammy, and anxious all of a sudden, listen to your body.
I know this list can sound frightening, but remember, knowledge is power. Your body talks to you. The problem is that we're usually too busy to listen. If you noticed any of these symptoms, the foot sores, the pink cough, or jaw pain, don't panic, but do take action. Make that appointment. Your heart works 24/7 for you. The least you can do is give it a checkup when it asks for one. If you found this video helpful, please hit that like button. It helps us spread this life-saving information to more people. And don't forget to subscribe for more tips on living a longer, healthier life. Take care of yourselves out there, and I will see you in the next video.